Professor Sir Rory Collins, it's a pleasure to have you here today. Would you mind explaining what UK Biobank is and what really differentiates it from other biobanks around the world?
The idea was that those data would be made available to researchers all around the world, both in academia and in industry, to do health-related research that's in the public interest, to find out how to prevent and treat disease better than we can now.
Can you give us an overview of the UK Biobank and explain why it's considered such a groundbreaking initiative for biomedical research?
We have scale, we have depth, and because it was established more than 10 years ago, we now have duration of follow-up, so we can look at how those risk factors are associated with the development of particular diseases. The most important aspect of UK Biobank is easily accessible to researchers all around the world. We get the imagination of the best scientists, wherever they are, finding out how to better treat and prevent disease.
Could you share some insights into UK Biobank's journey to the cloud?
So what we needed was to have a way in which the researcher could come to the data. The project for sequencing included funding to UK Biobank to establish a platform, and we've been supported incredibly well by DNXS and AWS with their cloud platform to facilitate access to researchers. It democratizes access because researchers who don't have big computers can come to the platform and get the compute they need when they need it. And it's helping us to extend access to the data. More and more access to data like the UK Biobank data will be on secure data environments, such as the UK Biobank platform. And so what we'll need to think about is how do we do analyses across these different platforms where the data don't move, but effectively the way in which you analyze them is as if they were in one place. And we're working closely with other similar groups, such as the All of Us study in the US, to try to help resolve the kind of technical problems we're doing it. The application of novel techniques, AI, machine learning, etc., are bound to find things that we wouldn't otherwise find with kind of more standard analytic approaches.
Can you share a surprising or unexpected finding that's come out of the UK Biobank data?
I think the best example of what UK Biobank was about was the whole development of the concept of the polygenic risk score. It was a PhD student working at the Broad in the US who accessed the UK Biobank data as part of his thesis, who demonstrated that that hypothesis was wrong, that actually you could combine variants of small effect. I like that one because it's so important potentially for prevention of disease, and it demonstrates the value of making data available to everyone, not just people with big computes, not just people with a lot of money, but to a student.
The focus of the World Health Summit this year is building trust for a healthier world. How has UK Biobank earned so much trust?
I think it's really important to think of the participants as participants. They're not data fodder. So it's very important to be telling them what you're doing and why you're doing it. So I think transparency about why things are done and why it is consistent with what they would want done, and then listening to them.
What's your vision for UK Biobank in the next decade, and how might it help shape the landscape of biomedical research more broadly?
Well, I hope what it demonstrates is that you can make data available, you can do so in a safe and secure way, and clearly a cloud-based platform where researchers are doing their work on the platform, where you can check what they're doing, where the data are not being downloaded, increases one's ability to do that. The cloud-based platforms, I think, facilitate that enormously because the data don't leave the jurisdiction, they don't leave the country. The researchers move to the platform. It means the data are much more secure. I think that without AWS, UK Biobank would not be able to do what it's doing. The world as a whole is to be very grateful for the role AWS has made in helping to better prevent and treat disease.
Professor Rory Collins, thank you very much.
Thank you.